As you may already know, breast milk is uniquely superior for infant feeding and has many benefits for infants and their mothers. Breast milk has ingredients that specifically protect the baby from illness and infection. Experts agree that breast milk contributes to higher intelligence and improved motor development due to the unique ingredients in breast milk that promote optimal brain growth. Other studies have indicated that breastfeeding may even protect the mother from breast and ovarian cancer. If you have a premature or sick infant, your breast milk is even more important. A mother who has a premature baby has breast milk specifically designed to meet the needs of her baby. But best of all, premature babies who receive their mother's milk get out of the hospital much faster than formula-fed preemies. By collecting and storing your milk, your baby will receive the many health benefits of breast milk even when you can't be together. Every mother wants what is best for her baby, and by breastfeeding, you are ensuring your baby the best possible growth and development. Congratulations on giving your baby the best.
Sometimes the most natural things are also the best possible things. You have made the decision to breastfeed your baby so you can provide the best nutrition possible and help protect your baby from illness. By using Ameda breastfeeding products, you are using one of the safest, most natural, and most effective systems available. The Elite Breast Pump, available with a discreet carrying case, is a hospital-grade pump designed to be used in the hospital, at home, or at work. The Elite Breast Pump weighs only 6 pounds, yet offers hospital-quality performance with a wide range of suction levels and cycle speeds. You can adjust the pump to mimic your baby's natural nursing pattern and maximize your milk production. The Elite Breast Pump is designed to be used with the dual HygieniKit milk collection system to help provide the purest possible breast milk. Unlike other milk collection systems, the HygieniKit's patented design includes a silicone diaphragm. The diaphragm is designed to form a barrier. First, to help protect your breast milk from contaminants that may be present in either the pump or kit tubing, and second, to help prevent milk backup inside the tubing. Even if the collection bottle is turned on its side, your milk will not flow past the diaphragm into the tubing and pump. This helps prevent the tubing from becoming contaminated and reduces the need for maintenance. Your HygieniKit is sterile and comes pre-assembled so you may use it immediately with your Elite Breast Pump. First, plug the pump into an electrical outlet. Then, each time before you pump, wash your hands thoroughly with soap and water. Start your Elite Pump with the vacuum dial. Turn the vacuum dial clockwise to increase the suction. Adjust the suction to the highest level comfortable for you. Next, set the pump speed with the cycles dial. Again, turn the dial clockwise to increase the speed. Some mothers have found that their milk flows more quickly if the pump speed is set on high. Next, hold the HygieniKit to your breast so that your nipple is centered in the nipple tunnel. Hold the breast flange firmly but gently so it creates an airtight seal around your breast. Women who have small nipples may choose to use the reducing inserts that are included with each HygieniKit. With small nipples, the reducing inserts may help to improve pumping effectiveness. If the standard flange is too small for comfortable or effective pumping, you may wish to purchase the larger Ameda custom breast flanges for a better fit. When your breast milk begins to flow, this is known as the letdown. The letdown is a breastfeeding mother's natural reflex, the most important part of successful pumping. If you set the pump speed to high, this will mimic your baby's pattern of rapid nursing at the beginning and will help stimulate a letdown. Once letdown occurs, you may want to lower the pump speed to mimic your baby's slower nursing pattern. The Elite Breast Pump allows you to adjust suction strength and pump speed, so you can experiment and find comfortable levels that produce the most milk in the shortest time. To encourage the letdown reflex, it may help to massage your breasts with a light circular motion. A warm compress on your breasts may also help. Tilt the collection kit slightly to allow your breast milk to flow down into the bottle. Close your eyes, relax, and imagine your baby nursing at your breast. Because double pumping is more efficient than single pumping, you will reduce your pumping time if you double pump. Allow 10 to 15 minutes per session. If you single pump, switch breasts about every 5 to 7 minutes and allow 20 to 30 minutes per session. When you finish pumping, turn off the breast pump. Then remove the collection kits from your breasts. If necessary, break the suction by inserting a finger between the breast flange and your breast. When the suction is broken, remove the collection kit. Finally, unscrew the bottles and screw the locking caps into place. The bottles can be safely stored for up to 10 hours in the insulated cooler. It's always a good idea to date each milk container and to use the oldest milk first. Store your collected breast milk in clean, sealed containers. Use refrigerated milk within 8 days, then either freeze it or throw it away. You can store frozen milk for 2 weeks in the freezer section of a refrigerator. In a refrigerator that has a separate freezer door, you can store frozen milk for 3 to 4 months. In a commercial-grade deep freezer, you can store frozen milk for 6 months. After each use, clean the breast pump and the HygieniKit. To clean the pump, simply wipe the casing with a soft, damp cloth, using only water or a mild soap. All parts of the HygieniKit that come in contact with breast milk should be washed thoroughly. The tubing, adapter cap, and tubing adapter will generally not need to be washed because the silicone diaphragm prevents them from coming into contact with breast milk. The bottles, breast flanges, and reducing inserts can be washed either by hand or on the top rack of a dishwasher. The silicone diaphragms and white valves should be washed only by hand in hot, soapy water. Be particularly careful with the white valve. The white valve should always be washed gently and should never be scrubbed with brushes or anything abrasive. All parts should be air-dried. To reassemble the HygieniKit, first place the diaphragm into the piston chamber. Then snap the adapter cap, with the tubing attached, into place. Next, hold the white valve carefully by the thick edges, not the flat sides. The valve will compress slightly. Gently push the white valve securely into place on the bottom of the unit. The white valve is vital for proper suction and should always be handled very gently. Next, screw the collection bottle into place. And finally, plug the tubing adapter and tubing into the pump. The tubes from both collection kits should be plugged into the tubing adapter. If you are going to be single pumping and want extra suction, simply remove one tube and close the tab on the tubing adapter. For mothers who sometimes prefer a manual breast pump, the one-hand breast pump allows you to control vacuum, or suction strength, and cycles, or pumping speed, simply by squeezing the handle. Remember, each time before you pump, wash your hands thoroughly with soap and water. If your pump is marked sterile, you may use it immediately. If your pump is not marked sterile, boil all parts of the system for 20 minutes, then let them air dry. To assemble the one-hand breast pump, first push the small white valve into place on the bottom of the breast flange. Next, screw the collection bottle into the breast flange. Then, Push the piston seal onto the base of the piston. Attach the piston to the handle by simply flexing the handle and placing the piston into the groove. When you release the handle, the piston is secured. Next, place the piston inside the piston chamber. Then snap the collar around the pump body. The top of the handle should be perfectly flat. To begin pumping, first center your nipple in the nipple tunnel. Hold the pump so it creates an airtight seal around your breast and place your hand as high as possible on the pump handle. It's a good idea to begin pumping with a series of short, rapid squeezes, just as your baby might begin to nurse. This will encourage the letdown reflex. Remember, you can encourage letdown with a warm compress or by massaging your breast with your free hand. Try the massage or compress either before or during pumping. Once letdown occurs and your breast milk begins to flow, squeeze the handle more slowly and try the squeeze and hold technique. The technique is similar to how a baby actually nurses after letdown. Squeeze the pump handle, then hold the handle as your breast milk flows into the collection bottle. Continue to squeeze and hold until you need to stimulate another letdown. Short, rapid squeezes will once again stimulate a letdown. With the one-hand breast pump, you can mimic your baby's natural nursing pattern and maximize your milk production. The pump is designed to be used with either hand, and the handle swivels, so you can easily find a comfortable position. The one-hand breast pump allows you to control suction and pump speed just by squeezing the handle. The harder you squeeze, the greater suction you generate. The more rapidly you squeeze, the faster the pump speed. With the one-hand breast pump, each pumping session should take about 20 to 30 minutes, and it's a good idea to switch breasts every 5 to 7 minutes. When you have finished pumping, simply remove the pump from your breast, unscrew the collection bottle, and screw the locking caps into place. Finally, store your collected milk in the refrigerator or freezer. To clean the one-hand breast pump, disassemble it completely. First, remove the white valve carefully. Next, detach the handle, then gently pull the piston out of the piston chamber. Flex the center of the handle, and the piston will detach easily. Finally, remove the piston seal. Wash all parts of the system in hot soapy water and let them air dry. It is true that the most natural things are often the best possible things. Designed to be used in the hospital, at home, or at work, the Ameda Elite Breast Pump, HygieniKit, and one-hand breast pump can help you to provide the best nutrition possible for your baby.